We all want to feel and look great. Some of us are taking OZEMPIC. OZEMPIC is a drug that delays gastric emptying, and you've seen a lot of people are taking this and losing massive amounts of weight. How does this relate to plastic surgery? Well, when you lose weight, when you lose volume, or what we're talking about is fat, the face actually, which is plumped up by fat, becomes more flaccid, becomes more loose, and it hangs. So if you're taking these medicines, be careful, because if you lose too much weight, especially rapid weight loss, you can see real changes in your face where you might start looking older. Remember, the two main things that happen as we age: we lose volume, i.e. OZEMPIC, and we develop laxity. So my job as a plastic surgeon is to put you back to where you used to be. I restore volume and I move the tissues back to where they used to be. How do I restore volume? Well, that can be done with filler, that can be done with fat. I like fat transfer because it is a more permanent, more natural looking result. So if it's done beautifully, it can actually look superior to filler, in my personal opinion. How do I do this? I take fat from some part of the body, your arm, your thigh, your belly. Even though I'm not a body plastic surgeon, I take this fat and I use it, I process it, and I inject it into areas of volume loss. In rapid weight loss, what I see, the pattern of facial volume loss, I see it a lot in the temples, I see it a lot in the cheek. In this area, the deep cheek, the deep fat, kind of around the buccal space, this can look really hollow and you can kind of look emaciated. It's not a pretty look. We also can see volume loss around the eyes. It really just depends on your specific face. So if you want to consult with me and you think that you might have some volume loss that can be corrected from taking OZEMPIC, holler at me.